Today I'm about to check or to assess the head of the patient first. In assessing the head of the patient, I must first assess the skin color and check the size of the head. In checking the size of the head, I'm about to use this equipment. After checking the size of the head, let us now assess if there is an abnormal movement or twitching of the face. And check the face of the patient if it's in a normal facial symmetry. Look to the eyes and ear if it's on the same level. So after that, you will be testing if the cranial nerve or facial nerve check. So ma'am, can you remove your mask? As I can see, her face is in a normal facial symmetry and her eyes and ears are on the same level. Now ma'am, can you close your eyes? Open it, smile for me, then pop out your cheeks. Okay, thank you ma'am. So now we are about to assess if her face has any masses or any compensation.
But before that, let us first wear gloves.
Now that I am wearing the gloves, I am now able to touch the face of the patient to see any compensation or any masses. I see no masses or any compensation. That's all for the head. Let us now proceed in assessing the hair. In what I am about to do, we were about to feel if her head has any masses, indentation. Also, we're looking for skin breakdown and also check the back of the head. Also check the inside of the head. Make sure that there is no infestation. So now, I am touching or assessing the front view of the head. Next, the back of the head. And to see any infestation, I must look inside of the head. I see no masses, infestation, and indentation. That's all for the hair. Now we are about to assess the skin of the patient. Let us first inspect general skin coloration. Keep in mind that the amount of pigment in the skin accounts for the intensity of color as well as hue. While inspecting skin coloration, note any odors emanating from the skin. Inspect for any variation. Inspect localized parts of the body. No color variation. Check skin integrity, especially carefully in pressure point areas like the hips, elbows, and etc. In this video, I will be providing one clinical tip that in the obese patient or client, we carefully inspect for the skin on the lines under breast and in the ground area where problems are suspected. Inspect for lesion, and if you inspect for lesions, you have to observe a lesion, note its location, distribution, and configuration. Measure lesions with a centimeter ruler. Palpate skin to assess texture. Use the palmar surface of the 3 middle fingers to palpate the skin texture. Palpate to assess thickness, put gloves, and palpate lesions between thumb and fingers. Observe for drainage. Ma'am, can I touch your skin? I can see some color variation and I see no lesion, so we will not be proceeding to the process where if you find lesions, you are about to measure it with a centimeter ruler and etc. That's all for the skin. Now I will be proceeding to the neck exam. Let us first inspect and palpate the neck. If trauma is involved, this should be done before applying the cervical collar. Inspect the front of the neck with your partner. Hold the patient's head steady. Look at the jugular veins to see if they are flat, full, or distended. Jugular veins should be full but not distended when a patient is lying supine. Flat jugular veins may indicate hypovolemia or hemothorax, and you will need to look elsewhere for injuries. Look for swelling that would indicate bleeding into the tissues or subcutaneous emphysema from damage to a lung or another part of the airway. Since I have no partner, I will be the one who will make the head or neck of the patient steady. After the neck exam, let us now proceed to the assessment of the eyes. Let us first inspect for some eyes abnormalities, testing the cranial nerves responsibilities responsible for eye functions, which are the cranial nerve 3, 4, and 6. Assessing for nystagmus accommodation, pupil size and reactivity to light, etc. Inspect for eyelids, pupils, sclera, and conjunctiva. In assessing the eyes, we will be using this pen light. Is there swelling of the eyelids? No, there's not. Is the sclera white and shiny, not yellow as in jaundice? Yes, the sclera is white and shiny. Is the conjunctiva pink, not red and swollen? Yes, the conjunctiva is pink. And now for additional info, normal pupils clear should be 3 to 5 mm and equal. That's all for the eye. Now we are about to assess the ears of the patient. In this assessment of the ears, we will be using otoscope or tuning fork. Since we don't have that, let us now inspect and palpate auricle for lesions and tenderness. Look inside ears, assess ear discharge and tympanic membrane. We also need to do the whisper test if the client was able to hear anything I will say. Mom, did you hear what I said? Okay, that's all for the ear. So now let us proceed to the assessment of the nose, wherein we will be palpating the nose and assess symmetry. As I can see, it is symmetrical. Check septum. Check inside nostrils. Verify that the patient can breathe through each nostrils. Mom, can you breathe through your 2 nostrils? Okay. Verify patient sense of smell is intact. Mom, can you smell my hand? Okay. Palpate sinuses. That's all for the nose. Now let us proceed to the last thing to be examined or to be assessed, which is the nail. First, we need to prepare the client. We should ask the client to remove jewel, nail, enamel, artificial nails. Have the client sit comfortably and keep the door closed for the privacy of the patient. Explain what you are about to do and answer some questions that the client will have. I can also recommend that I will be able to instruct the client to cut the nails only after soaking them at least 10 minutes in warm water. Caution the client against the use of OTC preparation to treat corns, calluses, or inroads in toenails. Tell the client to cut nails straight, across, and even with tops of fingers and toes. If client has diabetes mellitus, tell the client to not to cut the nails. Instruct the client to shape the nails with a file board either. So now let us proceed to this step. Palpate the nail of the client to assess texture. What can I have your nail? Normal findings should be dark skin client may have thicker nails, older clients may appear thickened, yellow and brittle because of decreased circulation and extremities. Abnormal findings should be thickened nails. Now let us palpate to assess texture and consistency. Normal findings should be nails are firm and smooth, nail blade should be attached to the nail bed. And now let us test capillary refills in nail bed by pressing the nail tip briefly and watching the color change. Normal findings should be pink tone and turns immediately to blanched nail bed when pressure is released.
my final presentation, ma'am. Thank you.